Now, the other side to this is we talk about the effect of shunt on CO₂. So shunt can increase your PaCO₂ as venous blood returns to arterial circulation without offloading the CO₂. However, shunt doesn't typically raise PaCO₂, and that's for two reasons. And that's because there's a compensatory increase in our minute ventilation, as CO₂ is closely tied to our respiratory rate and minute ventilation, which I describe in my control of respiration videos. So hypercapnia leads to increased minute ventilation, and therefore a decrease in our PaCO₂. And this occurs because the blood has a much larger capacity to buffer and carry CO₂ than it does for oxygen, as we carry CO₂ in bicarb as carbamino compounds and dissolved in blood. So even these ventilated portions of the lungs are able to offload large amounts of CO₂, which is also more soluble and diffusible than oxygen. So it's more readily able to be offloaded at even the alveoli, or even with the limited amount of alveoli that are ventilated. You only expect a 15% increase in your PaCO₂ with a shunt of 50%. So relative to oxygen, you don't get that much of an increase.